Good afternoon, everyone, and welcome to our Nursing and Allied Health webinar. We are excited to have you. My name is Brittany Koons, and I am joined with my co-moderator, Colleen McIlvennan. And we're excited to present today this webinar called Forming a Patient-Family Advisory Council to Improve Outcomes and Patient Satisfaction, a Center-Specific Experience. And we have a great lineup of speakers here. We have Morgan Wall and we have Meg Fergurso from Inova Fairfax. They're both Nursing and Allied Health members, and they're here to kind of present on their center experience. And joining them are two patients who have worked with them on this, and we're excited to have them. So go ahead and take it away.
Thanks so much, Brittany and Colleen. So today we're going to talk about our PFAC. This webinar will share a center-specific experience forming a patient-family advisory council. A PFAC is an organization of current patients, family members, and caregivers that work together to advance best practices. Volunteer patients and families collaborate with their healthcare team to improve the patient and family experience. This webinar will share the motivation to form the PFAC, the how-to, and the impact on patient satisfaction and outcomes.
So this is the main motivations that we had at our center to create a PFAC. So it really stemmed from wanting to improve our patients' experience, giving them the highest quality care. And then we were also putting a big emphasis on the education piece, how we educate our pre-transplant patients and continuing education with our patients that are already transplanted. We do have a CF team here at our center as well, and they have their own patient family advisory council. So we really modeled ours off of what they were doing in their clinic. And then, of course, the pandemic really disconnected us from our patients and their families. So making this advisory council was a really nice way to get reconnected with our patients and what their experiences are. So this kind of shows a timeline of how the CF Foundation really built their patient family advisory council. They call it advisory board, but similar, basically the same thing. So you can see here that 20 plus years ago is where they got the idea to really partner with patients and their families to create better overall care. And then as the years progress, you can see that they, made it a national initiative for all CF centers. They added it to their reports for reaccrediting CF centers. And then they started, inviting them to their national conferences and including them in the planning committees for making their conferences. So they really put a big emphasis on making patients and their families equal partners in their care. So we, are modeling what we're doing really based off of the work that they did in CF. You can see here that this is a graph showing, the total number of CF centers, and then in blue, it's showing the amount of those centers that have patient family advisory boards. So a big uptick in the amount of them during 2020, 2021, height of the pandemic. But even still in the past year or two, it is a majority of the CF centers that still are utilizing the patient family advisory board. So this is an article that is from the American Hospital Association. So it's really giving a blueprint and strategies for clinics and to start their own patient family advisory councils. So the key takeaways that I took from this one is, they just are reiterating that it truly was a benefit during the pandemic to keep patients and their families connected with their centers by having these advisory councils. So it was a safe place for patients and their families to, say what was working, what's not working, ways that they thought that we, the care team, could improve the way that we were taking care of people. And I think one of the really great things is that they could show that it really did help with outcomes and reducing hospitalizations for patients. Two other articles here are other centers that do have patient family advisory councils as well. The one with the purple is a heart failure clinic, actually, that started utilizing a patient family advisory council. And then the other article is really just giving more information and data about how effective it is to include patients and their families in clinical, or making clinics better, essentially. The key takeaways from those articles, I think, are, again, they reiterated that in this specific heart failure clinic, they did show a decrease in readmissions with their patients just by utilizing the, making the changes and taking what they heard from patients and families and really doing real change with those things. And then they also did have an initiative where they were trying to improve hand washing compliance with the staff in their clinic, because that was feedback that they received from the patients and their families, and that they did improve the compliance with that. The other three things were strategies that they had in their patient family advisory council that are maybe a little different than what we've done here at Inova, but I think are still important things to consider. So one of them is successful PFACs must receive feedback. So I think that, goes both ways. So receiving feedback, which would be us as the care team receiving the feedback from patients and their families about what's working, what's not working, but then also us giving, the feedback back to our advisors about, this is what we tried to do. We heard what you were saying. We went and tried to implement it. This maybe worked. This didn't work. We need to go back to the drawing board to figure out a better way to maybe find a resolution to that. It's critical to set guidelines for meetings and membership, including term limits, attendance, and behavior. So in this particular clinic, they had term limits of 1 to 2 years, I believe, and they were switching up the people, the patients and their families that were included in their care councils. And then just really, making expectations clear for the advisors and for the clinical staff about attendance and communication and just how the expected behavior during the meetings. And then, of course, PFACs are generally a small amount of patients that are included in those. You can't have every patient in your clinic involved in your advisory council. So you should still be trying to get feedback and suggestions from all of your patients. So really still, doing surveys, having suggestion boxes, having other ways for other patients to communicate with you that aren't able to participate in the advisory council. So why PFAC? To kind of summarize why you would do this. So it really is a partnership between patients, families, and the lung transplant care team. It gives the care team an opportunity to hear from patients and their families that have unique experiences. So all of the patients, have different diseases that bring them to transplant. They have different, experiences with their index hospitalizations when they got their transplant, how their course went after that, if they've had a lot of readmissions, if they have, been in and out of clinic more often. So they all kind of have different perspectives and different things that maybe they got hung up on or thought could be improved. So it's a really nice way to hear those opinions if you're not, you might not think about those things. And it really can direct real change within a program, just hearing what needs to be fixed. So, and then improving the overall patient experience and prioritizing the things that our advisors are telling us, because they really are the speakers for the rest of the patients. It can lead to process improvement. So this could be with, scheduling appointments or the flow through clinic, how they are receiving test results from the care team, things like that. And then, of course, just improving the quality of care in general and making sure that it is the highest level of care. So how do you get started if you are interested in creating an advisory council in your clinic? So really the first step is buy-in from the clinical team. So you have to have, staff that is willing to put in the time and the effort and the resources to really, take it seriously, the advisory council, and take to heart what you're hearing from the advisors and make change out of that. So setting the goals. So what are your goals in doing the council in general? So these can be, vague goals, I think. So the, improving care and, maybe increasing compliance, just vaguer things. And then prioritizing down the road what specific projects would be the most helpful. identifying those team members that would be involved. So we have a diverse group, I think, of team members on our team. We have our nurse practitioners, some of our nurse coordinators, social work is involved, the quality team is involved, and our medical director also attends our meetings. So it is a good mix of different people on the multidisciplinary team that are attending these meetings. And then deciding what is important. So this is kind of taking your bigger goals and narrowing it down and prioritizing which tasks you think would be the best to start with. So even if you come up with 5 to 10 things that you want your advisors to help you with, really deciding which 1 or 2 would be the best to tackle first. So center readiness, so stability within the transplant team. So like I said, having a group of people that are able and willing to commit to being a part of the advisory council and really have a desire to develop a culture of collaboration with patients and families. I think that, kind of realizing that you might get feedback from the advisors that you weren't expecting to hear or that you didn't think was a problem in the clinic, and then you're hearing directly from them that it is a problem. So being willing to take maybe some criticism and really make real change to have a better patient experience is important. And then along the same line, finding the patients and their family members that are equally as enthusiastic and willing to serve on the PFAC, because it is their time and effort and resources as well. They, have to really critically think about how their experiences are in the clinic and be willing to give advice on how we can make things better. And then support from your program and center leadership is also important. We have one of our managers from the transplant team in general that attends our meetings along with our medical director. So, if we do have a problem that we maybe think of a solution that needs to be handled maybe higher up than we can handle, it is nice that we have those advocates sitting in on our meetings that are able to take those conversations to a higher level if need be.
Okay, so the logistics for us, the clinical team met to discuss goals, targeted board member capacity, criteria for advisor selection. I think Morgan touched on the diversity of our clinical team. So we made sure we had social work involved, nurse coordinators, clinic nurses, our nurse practitioners, admin, our managers, and our medical director. And we really felt like that was important because if issues came up, especially concerns directly from patients, we were more easily able to escalate any concerns to be able to have a discussion and problem solve. And then once we got our group together, we identified and invited a diverse group of patients and families to participate. And really what we did is, as a team, we said, who would we recommend out of our patients? Who would be a good fit? Who do we think would be interested in this? And again, we tried to pick a diverse group. We asked folks that were earlier in their transplant journey. We asked folks that were a little further along, folks that had different types of social support, and from different backgrounds as far as diseases that brought them to transplant. Some PFACs actually put out a notice, almost like a job description, and ask patients to submit an application. We just did it in a little bit more less formal way. And then for our group, we decided to meet quarterly virtually, but many groups meet either more frequently, less frequently, and in person. But we felt like the virtual meetings, obviously, since we started around 2020 ourselves, were the appropriate way to manage the group, and we have continued with that. And really what we decided was we were going to focus on patient suggestions as well as QI initiatives identified by the transplant team. So this is kind of an example of, sample initiatives that you could consider. Educational material design, revision of existing website, develop discharge materials, develop tools to support family participation, improvements to clinic efficiency, and just general enhancements to patient and family experience. And you can see on this little schematic, these are kind of like the core values that we focused on. So really the patient experience, patient and family communication, quality improvement, policy development, patient safety, and patient education. So this is our Lung Transplant Patient Family Advisory Council at Inova. And we as a group met together and created our mission statement, which I'll read. The Lung Transplant Patient and Family Advisory Council at Inova Fairfax Medical Center is committed to enhancing the delivery of safe and quality healthcare by facilitating effective collaboration with Inova lung transplant team members and pre- and post-transplant patients to provide a greater level of insight and understanding of the patient experience and what to expect throughout the various phases of transplant. And this is one of our actual agendas. So every meeting we read our mission statement to keep us kind of focused and on course. So for this meeting, we talked about feedback on other lung transplant centers' websites because we wanted to know what could we do better, what are we missing? And our patient advisors are wonderful, and as Morgan said, they donate their time and their resources, and they oftentimes have homework that they have to do some work outside of the meeting, and they really bring back a lot of great insights for us. One thing we have been working on is a lung transplant newsletter. We're always looking at clinic efficiency because who knows better what's happening in our clinic than the patients that have to navigate the process. Always safety. And at our last meeting, we did talk a little bit about our process for new advisors and tenure for our PFAC members. So these are PFAC projects that are either we have completed or in process. One is a transplant education binder. So we really value the feedback from our patients and families to share with us how our educational materials are working for them. And one thing that came out of this was, we give them a huge 3-ring binder that's probably got 50 pages of material. And the thought was, could we just have kind of a down and dirty, tell us what's really important? What should we really focus on? Because as we know, it's super overwhelming right after transplant. And so this really helped us focus on that. We also worked on a transplant go bag list, a progressive mobility input. Again, we are continuing to work on our webpage for feedback from patients. We were exploring options for a transplant-specific social media page, and we always want to ask, what is your experience in clinic? Could we be doing better?
So this is the go bag packing list that we made for our patients, and this really came from hearing from our pre-transplant patients and what happens when they get the call. There's a lot happening, obviously, but what they could have ready or what they needed to bring with them to the hospital, almost making a go bag like when you're going to have a baby. So we asked our advisors to help us put together this list of what the important things are and what they thought was helpful to have in the hospital. So kind of meshing that with, these specialty meds and the oxygen stuff that we know that we want people to bring with them. But, the changes of clothes, the chargers, the toiletries, those are things that we really got from our advisors that they thought would be good for people coming in for their transplant to remember to bring with them. And then this is the mobility chart that we came up with. So we had a QI project here to how we were going to help our patients be more mobile after transplant and their index hospitalization. So we came up with this visual aid that we put in all of the patients' rooms after transplant to help them keep track of how many laps they're walking every day and doing these other things. So we, had the rough draft of these charts, and we brought them to advisors to see if they thought that it would have been something helpful for them when they were in the hospital after their transplant to really help motivate them to get up and moving before they went home.
So these are projects that are in process right now. And again, we're really working on our web page. We have been working with a peer mentor program, and we're trying to formalize that. And then again, the patient newsletter. So to focus in on the peer mentoring, I think we've all worked with a pre-transplant patient that says, yep, no, I understand, I'm okay for transplant, I understand everything that might happen, and I'm fully on board. And you really know that they don't really understand the enormity of what they are about ready to embark on. So this really allows patients and their caregivers who are being evaluated for transplant or listed for transplant to have a post-transplant recipient mentor. And we find that these patients really benefit from hearing real life post-transplant experience. It's one thing if we are going through our educational slides and we're talking about potential rehospitalization, infection, rejection, but to hear someone's actual story of how that impacted them and how it impacted their family is, I think, a lot more significant and really tells the true story. We try to pair patients with similar backgrounds because we find if we have a younger patient who is struggling with the idea of transplant and wants to know what that's going to look like, it's helpful to have someone in a similar situation with a similar background. And that's actually worked very well for us. So now we are taking this that is kind of informal, and it's based on a sense that we get from pre-patients that maybe they need a little bit more help to really formalize this and do some specific training for our mentors and some really good feedback from both mentors and mentees about what we could be doing better. And we'd like to see this really for all of our listed patients. Right now it comes from our social workers or clinicians that have a specific concern, but I think it is beneficial enough. And I think actually our mentors, our transplant patients really enjoy the ability to share their experience. So it's been a really good initiative, and more to come on that. So I'll talk a little bit more about our clinician experience. We've had excellent buy-in from our leadership, and some of our leaders are actually on this call today. So we felt supported from the very beginning. We have found that we truly have a better understanding of our patients' needs just from these meetings and getting that feedback. There's certainly increased engagement from both patients and families. And this is really a sounding board for patients' concerns. I think sometimes if patient sees something concerning in clinic or something that is maybe not meeting their needs, it's hard to know who to go to for that. But this gives us kind of a safe space where we can really discuss as a small group any concerns or changes, and that's been really helpful. And based on that, we've had QI projects based on this feedback, and it's been successful for us. I'd like to share some thoughts from some of our clinicians. The first one is partnership with patients and families to improve the experience of care is so important to model as a best practice. Our ANOVA lung transplant PFAC quarterly meetings, both productive and fun, have enhanced overall program patient collaboration. Our dedication to advisors advocating for and directly engaging in various initiatives that have impacted patient safety, quality of care, and patient experience. Deeply aligned with our ANOVA value of patient always, our PFAC team supports actions that put patients and families first. It's been an amazing way to include them in decision making. They truly are a part of our transplant team. I've really enjoyed learning the patient perspective of their transplant journey and ways to improve the process for future recipients. And having a PFAC has helped to make sure that we are including our patients' voices, ideas, and perspectives in our quality improvement work. It makes the work more meaningful and impactful when I know that the changes are having a direct impact on patients and their relationship with the team. And then to share a quote from one of our patients, I've recognized the power of connection and information in mitigating the fear and uncertainty of managing an unexpected life-changing health condition. The things that have helped me the most are hearing from and seeing examples of others who've already walked a similar path. Programs like PFAC help formalize valuable support structures for patients that they didn't even know that they needed. And really, we wouldn't be here without our Patient Family Advisory Council patients. I think Morgan may have touched on the CF Foundation has found a way to give their advisors stipends. We're not quite there yet, though we'd love to be able to do it, but we do make them their certificates. And I want to personally thank from our center, Karen Carter, Ann Quack, who's on our call today, Beth Bako, Colleen Adamson, who's on our call, Vic Bako, and Ike Carter. They have been invaluable in helping us with this initiative, and they're always willing to jump in and help. They have great ideas, and they really have been the voice of our patients. So for all of our meetings, we do a group picture. And this is an example of us from meetings throughout the year. So that's always a fun. You can see on some of these pictures, we were on vacation. There's a beach in the back, you know. So we even jump in when we're not at work. So I would love to introduce and have you meet our PFAC members, Colleen Adamson and Ann Quack. A little bit about Colleen. She was diagnosed with cystic fibrosis when she was 1. She's from Central New York and worked for the federal government for 26 years. She had a bilateral lung transplant in July of 1998 and a living donor kidney transplant in March of 2006. She's currently the treasurer for the United States Adult CF Association, and she volunteers for our Nova Health System retail stores. And then we have Ann Quack with us too. She was diagnosed with LAM in 2011 after presenting multiple times with recurrent pneumothoraces. She had a double lung transplant in 2014, and she returned to an active, normal, and busy life. A year or so post-transplant, she returned to working as an industrial organizational psychologist, and she feels lucky that she's able to help businesses solve talent problems through analytics and measurement. So we can, I think, open it up to Q&A with our PFAC team members. And again, Colleen and Ann, thank you so much for joining us.
Thank you, Colleen and Ann. Just for those that are on the call, we'd love it if you put your questions in the chat, and we would be happy to read them going forward. But thank you so much, Meg and Morgan, for a great presentation, and look forward to hearing a little bit more about it through Q&A. So I'll go ahead and get started. Why don't we start with Ann, and then I'll ask the same question to Colleen. But what has your experience been like working with the PFAC?
It's been great, and I can't believe that it's been in place for so long, because it just seems, I think, a regular part of my life and my schedule. And a couple of things is, I think it's nice to meet other people who've been through transplant, you know, because they're going through sort of different stages. And it's one, really reassuring to see other people who've struggled with health issues doing great, living their life, doing things. And so I think that connection is great. And then just around the work itself, I'm impressed that our center cares so much about us, you know, as a patient group, and that they're always looking to make improvements, even like small things, like as Meg mentioned, sometimes we might digress and talk about some experience that happened at clinic, and there's always someone that says, hey, we can look into that and we can discuss that next time. And then also being, like, I think, strategic, right, in terms of like, hey, we know these things from our experiences working with patients. We have some like couple of projects we can work on. Let's figure out how your experience can like bolster the things that we're already working on. So I think it's wonderful that they're continuing to make those improvements and improve the quality of care for transplant patients.
Great, Colleen, we'd love to hear from you
I'll
also.
pass it to you, Colleen.
Yeah.
Sorry, I had to unmute myself. Yeah, I echo everything that Anne said. It's been wonderful. It's been so much fun. It's great meeting other people that have also gone through a lung transplant. And I especially like having the caregivers and hear what they have to say as well to get their perspective, because I find it so interesting. They're, they think of things that I don't think of, and I also, one of my first questions when we started this was, are we empowered to do things? Are we really empowered, or is this just a discussion amongst ourselves, and that's as far as it will go? But we, like Meg and Morgan said, we are empowered, and we have the medical director as part of the PFAC, and he's on there every meeting. It's wonderful. So I know that we're able to get stuff done because he's on there, and he's our advocate, and so are Meg and Morgan and all the other clinic folks, the social workers, etc. So yeah, I feel like we can accomplish things, and we have accomplished a lot of things. The only thing I would say is, and this was mentioned in the PowerPoint presentation, we don't really get a lot of feedback on stuff that we have suggested. Like, for example, we went through the material that the pre-transplant folks are briefed before, as part of their training. And so we suggested that there be like a quiz at some point, and then we had just to kind of make sure people are getting the information in their head, during every segment. And we had a test quiz that we all saw and all, played with. But then I never heard anything more about it, whether or not they actually did that, or if it helped or what. And the same thing for mentoring, and I know they're still working on finalizing it and formalizing it, but it would be nice to have feedback on the mentoring, because I have talked to several people. So it'd just be nice to know if I've helped or not, or how I could do better, And we did have training too, so that was wonderful to be a mentor. The other thing is, we really need to have a social media manager, because we have all these ideas, and the people that have to implement them are people that in the clinic that already have full-time jobs. So how do you, so I think it's so important to have a social media manager. Okay.
Thank you so much. I don't think, do we have any questions in the chat yet? I don't think so yet. So I have a question. This could be for Meg or Morgan or Colleen or Anne. But I guess what have been some of the challenges with the PFAC, either in getting it started or engaging people or retaining interest, those types of things?
Well, I think Colleen probably brought up one of those challenges, and that is we've come up with a lot of great initiatives and have had to focus on 3 or 4, kind of priority projects. So we have other projects that are in the works, and, I think this is something that the CF Foundation has acknowledged. And as I mentioned, we didn't realize this, but they actually give a stipend to their advisors and clinicians, because this is really something that is being done outside of our full-time jobs. So as Colleen said, the quiz that we did for pre-transplant is in the works, but we haven't finalized. And I think, as I mentioned before, the mentoring, we have made a lot of progress on that, but that hasn't finalized. And we are working on getting a little bit more support for our webpage, because obviously that was a big focus too. But sometimes it's hard to have the resources to complete all the projects. And so sometimes it might be slow going, but you have to say our advisors are so patient and understanding. And as Colleen says, they bring it back up and they say, hey, you know, this was important. This now has to be the next priority. So I think that's been really helpful.
I have a thought. And this came up, I had this thought, Megan Morgan, when we were talking about like how long people should sit on the council and how long should they serve, and do we have ideas on who, you know, who else we should recommend and things like that. But then I realized when we started, I think our group was just a little bit bigger. I remember there being other people on the call in the beginning, and then I think we landed on this core group that's been kind of working together. And so my recommendation moving forward is, like, if I roll off and we think about adding other people at some point, is to think about diversity. And I know that's something that you mentioned when you talk about membership on this, because there is such a range of different diseases. That's one thing. And then Meg, you talked about also like age or phase in life, which I think affects a lot of things post-transplant beyond just medical care, but like well-being and relationships and all that stuff that people can speak to. And then the other piece I think is like culturally, right? Because I think certain demographic groups, like there are cultural norms about how you get medical care or like where you get social support, and like we only understand our own experiences, right? And so to be inclusive, and if we really want to provide the best care for everyone and, you know, reach the people that really need it, it would be great if we could be more, have those voices as part of the process. And maybe, Meg, it goes back to like, how do you incentivize people to be part of this? Not to say that something tangible is going to change it, but just knowing that it's hard for them, you know, because maybe for medical reasons or family commitments or whatever, like how do you figure out ways to include people to maximize like your reach and stuff? Yeah. But I understand that's a big problem to solve.
For a second. And that's a really good point. And I think that's something that we really do need to look at. I think we've been very comfortable with our core group because we've been so successful, and we're a very tight group. And as you said, when we were putting the slides together, we're like, wow, I can't believe we've been doing this for as long as we have. But we really have gotten a lot done. But I think you know, you get to a point where you say, gosh, we don't want to lose our advisors. It's really going well, but how big can we make the group? Could we add just a few more folks that maybe, as you said, folks that maybe are a little underrepresented currently, so that we're really getting everyone's perspective. So thanks for bringing that up. It's a really good point.
And I also think, you know, it would be nice to stay on the board long enough to see some things come to fruition. That would be nice. That would be nice.
No, I think that's a good idea. And I think there's something to be said for, you know, starting the project, seeing it through to completion. Sometimes I think it's hard when someone joins and you're like, this is the initiative. And they're like, well, that's not really that important to me, or what, you know, kind of what were you thinking? So I think we have gotten a lot completed, but we have a lot more work to do. And that's why, you know, I think at one point we said, well, what's the tenure like? And I think all of our advisors were like, we're still good, we'll stay on. And we said, great, awesome. So I think maybe we just need to invite a couple others. And I think one of our advisors was like, maybe we can do special invitation. A couple of people can come here and there. So that was one suggestion too.
Those are great thoughts. Thank you for sharing. And we actually have a question in the chat from Kristen. I would like to maybe start with Meg and Morgan for this question, and then if we could move to Anne and Colleen to add on from a patient perspective. But what advice do you have to start up PFAC for a transplant or VAD clinic, such as an article or website, which you can reference from your PowerPoint? And then did you have startup funding?
So yeah, we did not have any funding. So it was a labor of love for all of us. And, I think, learning from our CF clinic that had already started meeting as a PFAC group made it a little bit easier for us, because we said, well, they can do it, then we can do it here. We'll just borrow all that information. So we got a good deal of information from them. And then I think, as you mentioned earlier in the PowerPoint, which we can send out, we do have some articles. The American Hospital Association has a blueprint for starting a PFAC. And I think really the key is dedication. You need to have a clinician group that is dedicated to hearing patients' concerns, ideas. And once you establish that, and then you move on to pick your advisors, the next thing is really kind of tangible goals, because I think sometimes if you say, well, we're meeting and, what's everyone think? It's hard to get some like good momentum going. I mean, I think you'd always open it up for, hey, these were 3 things that we've kind of heard feedback. It's important. How important is it to you? And then whatever suggestions, our advisors have, we always kind of prioritize that. So I think that has worked out well for us.
Yeah, that's what I was gonna say. Just coming up with like specific projects or ideas that you want feedback on or need help with figuring out, I think is important. You have to have some kind of direction for what you're gonna do during the meeting.
Thanks for that question.
Anything to add, Anne or Colleen, from your perspective? What was helpful from kind of an orientation standpoint, or I think also like making the commitment to do this? Was there anything that was helpful in making that decision?
For me, it was nice to be able to help others, because I'm almost 26 years out from my lung transplant. So I feel like I have I've gone through a lot. So I have a lot of experience that I am happy to share with the PFAC and be a mentor for other patients. So it's just been wonderful. And like others have said, we have a great group of people. And empowerment, again, is such an important part of this, that what you're doing will become a thing, and you're helping others.
I think Morgan made a great point about having a clear focus on some of the issues that you want to address as a clinic. So maybe as patients, we don't understand it, but they've already sort of curated some things where they say, hey, these are areas that we want patient input on. So for me, I think that feels like, hey, this is a good use of my time. I'm here to work on something that people are going to take action on, versus it feeling like just a meeting where people discuss things and then nothing really happens. So I think that is really compelling. And then the point Colleen made about just realizing how, as a patient, when you're on the other side, especially pre-transplant, like it's just so overwhelming, and you have so many questions and lots of anxiety about like what's going to happen. But like having the experience of gone through everything and then realizing there are other people still like on the other side, like I think it just feels really good to be able to like bridge that gap for other people.
That was great. Thank you. If there's no other questions in the chat, I don't see any right now. I have a question about the family and caregiver participation in this. What have you learned kind of from the family members or the caregivers? And is it difficult to get them engaged in this because now we're asking them to do another thing? And did you kind of find a need for them to have maybe a separate group, or is it working to have everyone together?
I think that it works great with everyone together, and maybe we're just lucky with the people that we picked, but I feel like the caregivers that are involved in our PFAC are just as, or sometimes more vocal about things that they've experienced or what they noticed that happened through the process with their loved one. So I think it's a great addition to have both perspectives, because it's obviously very different for the patient that's going through the transplant versus the person that's helping them through it, watching everything happen, and what can help them too, because it's a hard process for them as well.
Yeah, I would agree with that. And actually, Morgan and I were talking about this earlier, and sometimes we feel like it's almost more important for the caregivers to have a true idea of what transplant looks like, what the commitment is. And that has really been helpful in our mentor program. But just with the PFAC also to have the significant others, the family members, the caregivers saying, oh, but you know what, when you really go home, here were the things that were really challenging. The logistics of getting, my loved one back to clinic, or getting the phone call from the transplant center, about coming in for the transplant, what that was really like. So it's, I think, been hugely helpful, and we've gotten a lot of good feedback from that as well.
And one of the caregivers is a nurse, so she really understands a lot, and it's just very helpful to hear her perspective. And yes, they are very, the caregivers on our group are very vocal in a good way, and I think that's because they're caregivers and they're probably used to that.
Are the caregivers sorry, I have one more question. Are the caregivers that you have involved typically also the caregivers to the patient who's involved, or are you having this mix of patient and then separate caregivers? Kind of how are you recruiting people on that?
So now we have the caregivers and the patient, so it's them together on the meeting. We don't have anyone that doesn't have the patient there with them.
Right.
Yeah.
But I think we have mentioned something specifically for caregivers. And I think there's something to be said for that. And like I said, when we talk about our mentor program, a lot of times what we're talking about is, who can we pair the spouse with to really get a good idea of what this journey is going to look like? Because I don't think we can stress enough how important caregivers are to our patients and to their journey and to outcomes. And I mean, that is a big deciding factor when you are bringing someone up for discussion for transplant. It's, do they have the support to really be successful and be safe?
Yeah, even sounds like from the formation and the title, you had family engaged, which obviously I think a lot of people on this call, really understand the importance of that. So I think if there's any more questions, feel free to drop it in the chat. But I'd love to end with sort of any final thoughts, anything we did not ask you that you'd like to share. I'll start with, again, Meg and Morgan, and then would love to hear from Anne and Colleen as well.
I think that this has been just a really incredible experience for both our clinicians and staff and the patients. And I feel like, in transplant, you really get to know your patients and you really get to know their families. And so they're part of your transplant family. And with our PFAC group, these are folks that we get together with, not just in a clinical space, but in a personal space. And so I'm just so thankful for them being so open and honest, and again, patient with us, because sometimes concerns that they bring up we can't solve immediately. And I think great ideas that they have take some time to really get put into motion, but they're always very patient with us, and they always show up. We never have an issue where people don't show up to meetings. They are there 100% of the time, which I think says a lot, because I think there are other situations where, you know, you're like, oh, but they are there for us. And so we really, really appreciate that.
Yeah, I agree. I don't have much to add.
Colleen, anything to add?
No, for me, it's just been a great experience, and I'm honored to be a part of this PFAC.
I share the sentiment with Colleen, and I think if you're thinking about doing this at your hospital, I would encourage you to consider people that you think would be good, like good as a representative, but may not be inclined to do it, because I think that represents me. Because if someone asked me, say, hey, like, hey, will you volunteer to do this thing? I probably would not have raised my hand. But like, because I think I've developed, especially such a really great relationship with Meg as my regular nurse. And when this came up, I thought, hey, you know, I'm not sure how much I can contribute, but it's been super rewarding. So I think just thinking about your patients and if who might be involved, I'd say consider those people that you think even might say no. Yeah.
Great advice. Well, thank you very much for sharing your experience. When coming up with ideas for a webinar, this was a unanimous yes, unanimous vote. And particularly, we really thank Anne and Colleen for joining us to give your perspectives. I think it added so much more to get your engagement on this. And thanks to Meg and Morgan for leading the way and sharing it with our nursing and allied health community. Brittany, any final thoughts?
No, just, you know, thank you. As Colleen said, this was really great. And I'm sure a lot of people will go back and listen to this as they want to develop this at their centers. And hopefully it would be okay to reach out to you guys if they decide they want to do this.
Yes, absolutely. Thank you for having us, and thank you, Colleen and Anne. You're amazing, and we're available if anyone has questions. And we, you know, really encourage you to consider it at your center, because it's really made a difference for us.
Yeah.
Absolutely.
Thank you all.
Thank you.
Thank
Thank
you.
you.